Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine this scenario. There's a hidden heart condition, it's lurking silently, and even the best doctors, well, they're struggling. They can't quite predict who's really at risk of a sudden, potentially fatal event. The stakes are just incredibly high. We're talking about saving lives, preventing awful heartache, and also avoiding maybe unnecessary invasive medical procedures.
It's a huge challenge in cardiology, it really is. For, well, decades, the big question has always been, how do we reliably pick out those people who are at the highest risk for sudden cardiac death?
Right.
Especially with something complex, an inherited disease like hypertrophic cardiomyopathy. It's a puzzle that's really stumped the medical field for a long time.
So if it's been such a tough puzzle for brilliant medical minds, what's the missing piece? Is it just, too much data? Or is it something trickier that humans just struggle to analyze in these cases?
Well, that's kind of the crux of it.
Because, look, this is where it gets really interesting. Artificial intelligence, AI, might actually be the answer we've been looking for. Today, we're doing a deep dive into some pretty groundbreaking research. It's coming out of Johns Hopkins University. Their researchers have built an AI model, and it seems to be significantly outperforming the traditional ways doctors predict sudden cardiac arrest.
That's absolutely right. The human eye, our current analytical tools, they just can't process the sheer volume and the subtlety of the information sometimes. This new model could be a real game changer.
So our mission today, for you listening, is to unpack how this AI actually does that. How does it achieve such impressive accuracy? But maybe even more importantly, what does this all mean? How does basically doubling prediction accuracy change things for patients? What does it tell us about, well, the limits of our current methods? And, how does this reshape the future for truly personalized heart care?
To really grasp the impact, let's first talk a bit about the condition itself. Hypertrophic cardiomyopathy.
Okay.
You might know it's actually quite a common inherited heart disease. It affects maybe 1 in every 200 to 500 people around the world.
Wow, that's more common than I thought.
It is. And critically, it's a leading cause of sudden cardiac death in younger people, even athletes. So getting that prediction right and early is just vital.
And that really highlights the doctor's dilemma, doesn't it?
Right.
So many patients with this condition live totally normal lives, no major problems.
Right.
But then there's this small, unpredictable group who are at a much higher risk of sudden cardiac death.
Yeah.
And for doctors, figuring out who exactly falls into that high-risk group has been, well, almost impossible.
Yeah.
And you just imagine the stress, right? For everyone involved, living with this sort of hidden threat without knowing if you're the one it's going to affect.
Precisely. And, just to give you a sense of the tools doctors have now, the clinical guidelines, the ones used across the U.S. and Europe to spot these high-risk patients,
Yeah.
they have about a 50% chance of getting it right. 50%.
That's not great.
No. Natalia Trayanova, she's one of the senior authors on this study. She put it very bluntly. She said it's not much better than throwing dice.
Throwing dice? Wow.
Yeah. That really hits home why we desperately need something better, something more accurate.
Okay, throwing dice. That definitely paints a picture. So let's get into this better solution then. It's called MAARS. That's M-A-A-R-S. Stands for Multimodal Artificial Intelligence for Ventricular Arrhythmia Risk Stratification.
That's it.
And that word, multimodal, that seems really key here. It tells you why this model is potentially so powerful, right? It pulls information from lots of different types of patient data. It integrates them. It doesn't just rely on one thing.
That holistic view is absolutely what sets it apart. MAR looks at comprehensive electronic health records, the patient's history.
Okay.
It looks at detailed reports from echocardiograms, those heart ultrasounds, and reports from cardiac magnetic resonance imaging, the MRIs.
Right, the standard stuff.
Yes, but here's the really innovative part. It doesn't just look at the reports about the MRI scans. It actually dives into all the information hidden within the raw, contrast-enhanced cardiac MRI images themselves, the actual pictures of the patient's heart.
Ah, okay. So it's bypassing the human interpretation layer in a way. It's looking directly at the image data.
Exactly. That seems to be the hidden clue. While doctors, they look at these images, but interpreting them consistently for this specific risk prediction has been tough. The AI model, though, it zeroes right in on critical scarring patterns. It's called fibrosis.
Fibrosis, okay. Scarring on the heart muscle.
Right. And we know this scarring increases the risk of sudden cardiac death. But as Trayanova pointed out, people haven't really used deep learning on these raw images in this way before. She said, "We are able to extract this hidden information in the images that is not usually accounted for."
So it's finding signals in the noise, basically. Things that were there but maybe too subtle or complex for us to reliably see and quantify before.
Precisely. It's a huge leap in understanding what these images can actually tell us. And the way it does this, technically, it uses a pretty sophisticated deep learning approach, transformer-based neural networks, if you're familiar with those.
The same kind of tech behind things like ChatGPT.
Sort of, yeah, related concepts. It has 3 separate branches, one for each type of data: the health records, the imaging reports, and those raw MRI images.
Okay.
Then there's what they call a multimodal fusion module. It basically brings all the insights from those 3 branches together synergistically. It combines the knowledge.
So it's creating a much more complete picture than any single piece of data could provide.
Exactly. A more holistic, and it turns out a much more accurate assessment.
Okay, let's talk about those accuracy numbers, because this is where it gets really compelling. Compared to the current guidelines, the throwing dice method at around 50% accuracy. This AI model, MAARS, achieved an impressive 89% accuracy. 89% across all the patients they tested.
It's a massive difference, almost double the accuracy.
It really is. And it gets even better, right, for a specific group.
Yes, and this is really important. For the people who are often most at risk among hypertrophic cardiomyopathy patients, those aged 40 to 60 MRRs was an incredible 93% accurate.
93%.
Yeah.
That's not just a small step. That feels like a huge leap forward for precision medicine in this area.
It really does, and you can hear it in what the researchers themselves are saying.
Yeah, what did they say?
Well, Natalia Trayanova, the senior author, she emphasized, "We have the ability to predict with very high accuracy whether a patient is at very high risk for sudden cardiac death or not." Pretty clear.
Very clear.
And Jonathan Crispin, he's a cardiologist and a co-author, he added, "Our study demonstrates that the artificial intelligence model significantly enhances our ability to predict those at highest risk compared to our current algorithms, and thus has the power to transform clinical care."
Transform clinical care. That's a strong statement.
It is. And it's not just about the prediction itself. Another really powerful aspect is that the AI model can also explain why it thinks a patient is at high risk.
So it's not just a black box giving a number.
Exactly. It provides reasoning. This means doctors can actually move beyond a sort of one-size-fits-all approach and tailor the medical plan specifically to that patient's individual risk factors. That's a big step towards truly personalized care.
Okay, so let's connect the dots. What does this mean in the real world for patients?
Well, the potential is enormous. This model could, quite literally, save lives by identifying people who need protection, like maybe an implantable defibrillator.
Right, the device that can shock the heart back into rhythm.
Exactly. But just as importantly, it could also spare many people from getting those devices unnecessarily.
Because those aren't without risks or downsides either.
Absolutely not. They can have complications, impact quality of life. The researchers pointed out this difficult balance. Some patients are currently dying in the prime of their lives because they aren't protected, while others are putting up with defibrillators for the rest of their lives with no benefit.
So this AI could help find that sweet spot, protect the right people without overtreating others.
That's the hope. And significantly, the study also found the model performed well across different groups. It showed fairness in prediction, consistently doing better than the old methods, regardless of sex or age group.
That's crucial for ensuring equitable care. Now, you mentioned it wasn't a black box. How does it actually explain itself? How do we peek inside?
That's a great question, and it's vital for building trust in clinical settings. MAARS offers interpretability. It uses a technique called Shapley values.
Okay, Shapley values, what do they do?
Essentially, they quantify how much each piece of information, each data point contributed to the final risk prediction for a specific patient.
So it weighs the factors.
Precisely. For example, looking at the electronic health records and the imaging reports, the AI found that things like certain heart rhythm irregularities, non-sustained ventricular tachycardia, for instance, or atrial fibrillation, were associated with increased risk.
Makes sense.
Also, having the non-obstructive form of hypertrophic cardiomyopathy seemed to increase risk. And crucially, from the imaging itself, a higher percentage of that scarring, the fibrosis, or what's technically called late gadolinium enhancement.
Right, the scar.
That was a strong indicator of higher risk.
Okay, and what about factors that lowered the predicted risk?
Good question. The AI identified several. Things like achieving a higher target heart rate during a stress test seemed protective.
Interesting.
Also, certain measurements of the heart's size and function, like a higher left ventricular end diastolic volume, basically how much blood the main pumping chamber holds when a full or a higher left ventricular ejection fraction, the percentage of blood pumped out with each beat, those were linked to lower risk.
Okay.
And a couple other technical things, systolic anterior motion of the mitral valve and a higher pressure gradient in the left ventricular outflow tract during stress. But and this is really important to stress.
Yes.
These are statistical associations, correlations. They don't necessarily prove direct cause and effect.
Right. Correlation isn't causation, but they provide strong clues for doctors and researchers.
Exactly. They highlight areas for further investigation and help doctors understand the profile of a high-risk versus a low-risk patient according to the AI.
And you also mentioned something about seeing where the AI looks on the images.
Yes, that's another layer of interpretability. The model provides what are called attention maps. Think of them like heat maps overlaid on the cardiac MRI images.
Okay, like showing hotspots.
Pretty much. These maps highlight the specific regions of the heart image that the AI paid the most attention to when making its prediction. And very often, these hotspots correspond directly to those areas of fibrosis, the scarring.
So it's like the AI is visually showing its work, pointing to the evidence in the image.
In a sense, yes. It reveals the subtle relationship the AI has learned between specific patterns of fibrosis and the likelihood of sudden cardiac death. It makes the AI's reasoning much more transparent.
Fascinating stuff. But like all research, especially early stage, there must be limitations, right? We need a balanced view.
Absolutely, and the researchers are upfront about this. One key point is the cohort size. While it was a good size for this kind of proof of concept study, it's still smaller than the massive populations used to develop the established clinical risk models. And because sudden cardiac death is, thankfully, relatively rare,
Right.
there's always a risk of what's called overfitting. That means the model might be too closely tuned to the specific data it was trained on, and the estimates of its performance might have wider confidence intervals, meaning a bit more uncertainty.
Okay, so needs validation in larger, more diverse groups. What else?
Well, the model was initially developed at a single specialized medical center. That could introduce some bias related to the specific types of patients they see or their specific practices.
Institutional bias, potentially.
Right. Now, they did perform external validation using data from a completely different healthcare system, which is really important and strengthens the findings considerably. It shows the model wasn't just tailored to one place.
That's good to hear.
Another practical consideration is data requirements. MAARS needs quite comprehensive data. The EHRs, the echo reports, the raw MRI data.
Which might not always be available or easily accessible everywhere.
Exactly. That could be a barrier to implementing it widely in all clinical settings, at least initially.
Makes sense.
And one final point the study notes. They didn't have detailed data on when events occurred, just if they occurred during the follow-up period. So they couldn't fully assess the model's ability to predict risk over specific timeframes, like the risk within the next year versus the next 5 years.
Okay, so understanding the time element needs more work.
Yes, all these limitations really highlight the need for more research, bigger studies, longer follow-up times, testing in more varied clinical environments. That's the path forward to really confirm MAARS' role.
But even with those caveats, the potential seems undeniable. This feels like a really strong proof of concept for this kind of multimodal AI in cardiology.
It absolutely is. The research team is already planning to test the model on more patients. And they want to see if they can adapt the algorithm for other complex heart conditions, too.
Like what?
Things like cardiac sarcoidosis, which involves inflammation causing lumps in the heart, or another genetic condition called arrhythmogenic right ventricular cardiomyopathy. The potential applications could be quite broad.
So let's just recap this deep dive. We look at a really exciting breakthrough, haven't we? An AI model that dramatically improves our ability to predict sudden cardiac death risk in patients with hypertrophic cardiomyopathy.
Yes, by cleverly analyzing a whole range of medical data together, especially getting new insights from those raw cardiac MRI images, finding patterns that were previously hidden from us.
In this specific study, it really fits into this much bigger picture of AI transforming healthcare, doesn't it? It's showing us we can build powerful, trustworthy tools to support clinical decisions. Tools that could genuinely improve patient care, maybe directly by being used in hospitals eventually, or even indirectly, just by proving how powerful this multimodal AI approach can be. It shows us what's possible.
Which naturally leads to some fascinating thoughts for you, our listener, to consider as we wrap up. Thinking beyond just this one condition, what does this kind of highly predictive AI mean for the future of personalized medicine overall?
Yeah, how might it help us shift from just reacting to diseases to actually preventing them proactively? Could we see similar breakthroughs in other complex conditions like certain cancers or neurological disorders?
And maybe think about this too. How does knowing that an AI can potentially see things in medical images that even experienced doctors might miss? How does that change our whole understanding of diagnosis and what's possible?
It really does open up a lot of questions. It's definitely an exciting and maybe slightly unnerving time to be watching the intersection of medicine and artificial intelligence.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.